Okay, this is a brief talk on the Blunderbuss Apex. This is a normal structure that is often or can be misinterpreted for pathology. So let's first discuss the normal appearance of the root. So a normal root is long, comes to a tapered end, and on average the root, it's maybe 1.5 to twice the length of the clinical crown. But again, notice the very long appearance with a tapered end. Again, that's a normal, fully developed root. So what is a blunderbuss apex? It's a normal appearance of a developing root. It's an incomplete apex with a flared end as opposed to the tapered end of a fully formed root. So here's an example. We have a molar with a developing root. You can see here the root is still somewhat short and it's got a flared open apex. That is a blunderbuss apex. It's a root that is still developing. Here's another example. Again, this is a mandibular molar. You can see the roots are short. There's a flared open appearance of the apices of both of these roots. Again, this tooth is still developing, and it's important to know the age of the patient. So if this is a 6-year molar, you would expect the roots to still be developing even after 6 years of age. So if the tooth erupts into the oral cavity at about 6 years of age, the roots may continue to develop and close their apices 1 to 2 years after that. And in case you were wondering, this is a blunderbuss. It's a short-barreled gun with a flared muzzle. So that's how the blunderbuss apex gets its name. So the differential considerations are also what this blunderbuss apex tends to be confused for, and that is a periapical radiolucency that could represent a periapical abscess, cyst, or granuloma in the setting of pulpal necrosis, or root resorption can also look like a blunderbuss apex. So I just want to mention that root resorption, it doesn't mean that something's aggressive or non-aggressive. It's very non-specific. It can be seen with infection and inflammation. It can be seen with cysts or tumors. So let's look at the blunderbuss apex versus the periapical abscess. So a blunderbuss apex is short and flared. So what do we have here? We have a tooth that has lucency around the root. The root doesn't appear to be significantly shortened. Maybe you'd argue it looks a little short. It's certainly not flared. If anything, it might be just a little blunted there. And remember, you always want to look at the contralateral side because symmetry is your friend. So the other side looks pretty normal, and the roots are about the same length. So I wouldn't consider this one to be significantly shortened, not when I compare it to the other side. And it's certainly not flared. So this is not a blunderbuss apex, and this has the appearance that looks like a periapical radiolucency in the setting of decay. I don't think you can definitively see the decay on this tooth, but it is treated with an amalgam, so it had decay in the past and certainly is at risk for decay going forward. So again, just contrast that appearance of this periapical radiolucency with the blunderbuss apex that we've seen before. All right, now let's look at the blunderbuss versus resorbed root. So both will be short in this circumstance, but a blunderbuss root will be flared, whereas the resorbed root will be tapered or just blunted. So here, what do we have here? We have roots that definitely look short. They're not flared, but they don't really taper. This one's sort of just chopped off. This one also kind of looks chopped off. So this looks like a resorbed root. Let's see if we can compare. This is a tooth in a similar location that is developing, and you've got a short root that is open, and that is a blunderbuss apex right here. Both have sinus opacification, so this over here was likely a lesion, and this may have been a lesion, this may have been inflammation, I don't know. But you definitely don't want to confuse root resorption from a lesion with normal root development. And again, age is going to be very important. So for a developing tooth, it would need to be basically the age of an erupting tooth. So for a 6-year molar, it should be 6 years or shortly thereafter. Okay, quick summary. A blunderbuss apex will be short and the terminus will be flared. For a periapical radiolucency, the root length should be normal and the root terminus will be tapered. And for root resorption, you will also have a short root, but the terminus will not be flared, it'll be tapered or blunted. And again, remember that root resorption is not specific, so you could have a periapical radiolucency from an infection and it could cause some root resorption. So not everything fits neatly into one of these categories. In conclusion, the blunderbuss appearance is normal in developing roots. It's characterized by a short root with a flared terminal end. It can be confused with a periapical abscess and a resorbed root. And the length of the root and the flared terminal end can distinguish a normal blunderbuss apex from pathology. And remember that patient age is key and that symmetry is your friend. Here is a blunderbuss and here is a blunderbuss apex, just to drill it into your visual memory.